first of all, the thing that we need to realize is people talk about the sticker shock of Medicare for all. They do not talk about the sticker shock of the cost of our existing system. In a Koch brothers funded study, if any study is going to try to be a little bit slanted, it would be one funded by the Koch brothers. It shows that Medicare for all is actually much cheaper than the current system that we pay right now. And let's not forget that the reason that the Supreme Court upheld the Affordable Care Act is because they ruled that each of these monthly payments that everyday Americans make is a tax. And so while it may not seem like we pay that tax on April 15th, we pay it every single month, or we do pay a tax season if we don't buy, these plans off of the exchange. So we're paying for this system. We Americans have the sticker shock of healthcare as it is. And what we're also not talking about is why aren't we incorporating the cost of all the funeral expenses of those who die because they can't afford access to healthcare? That is part of the cost of our system. Why don't we talk about the cost of reduced productivity because of people who need to go on disability, because of people who are not able to participate in our economy, because they're having issues like diabetes or they don't have access to the healthcare that they need. I think at the end of the day, we see that this is not a pipe dream. Every other developed nation in the world does this. Why can't America? And that is the question that we need to ask. We have done these things before. We write unlimited blank checks for war. We just wrote a $2 trillion check for that tax cut, the GOP tax cut, and nobody asked those folks how are they going to pay for it. So my question is, why is it that our pockets are only empty when it comes to education and healthcare for our kids?
AOC is on point. AOC is a firecracker. She's come out, she's thrown her support behind Bernie Sanders, and as a lieutenant pushing for these particular policies, she has said on more than one occasion, we got to primary some folks. If I want to get my political objectives accomplished, we need a different composition of the House of Representatives. She's absolutely right. And this particular point, her argument for Medicare for all is on point. I mean, basically, people take home more money in their paychecks. It is a massive tax cut from the standpoint of us. Our income pay goes up. Think about it for yourself. Think of all the money you pay for healthcare. That is indeed a tax, and that healthcare is paid to a corporation that takes that money and does things in order to cut your healthcare, your access to healthcare, even the medications that you use, the pharmacies that you go to, all to maximize their profit. They have a disincentive in order to assist your best notions of healthcare, because the best notions of healthcare is always leveraged or weighed against their profits. What AOC is saying here is right. If you think about all the money you pay for healthcare, think of all the premiums that you pay every time you go to a doctor's visit, that's a tax. Every time you got to get a procedure, that is a tax. And it is a regressive tax because ultimately you, who might make, let's say, $65,000 a year, is paying the exact same amount, roughly so, as your boss, who may be making $1 million. You pay it by yourself, all on your own. It's a regressive tax. What Sanders is saying is, let's make this a progressive tax, meaning that you pay according to your need and according to your ability to actually pay, not necessarily as this just kind of flat tax. Your boss, under these circumstances, will pay more so that you pay less. So if you're making $65,000 a year, for example, one example might be you end up paying $15,000 for your health care as is. So you bring home, let's say it might be $50,000. The moment that you get rid of that, now you're bringing home $65,000. And when you look at the amount that you need to pay for healthcare, that's leveraged against how much you actually earn. So you and your boss will be paying different amounts. He ends up paying more. You end up paying less. You bring home $65,000. You might now pay $4,000 in taxes as opposed to the $15,000. So your total is $61,000 that you're putting in your pocket. Your boss, whatever his is, he's paying more. But understand beforehand, you were bringing $50,000 home as opposed to the $65,000 because 15 of that was being paid towards taxes to a corporation for healthcare. Her point is your expenses, you as an individual, for 95% of the population goes down. Your bring home and the money that you bring home goes up. Your concern about getting an illness and not being able to pay for it goes away. The amount that you pay at point of service, meaning when you go to the hospital, when you get a surgery, when you got to get your med, dramatically goes down. You pay nothing at the point of service from the standpoint of getting any kind of medical thing dealt with, and even from the standpoint of your bills, copays go away. The amount that you pay when you get a hospital thing, when you get surgery, goes away. All of those things goes away. Your premium goes away. At least, again, point of service. And the amount that you pay for the entire year for drugs isn't more than $200. She's right. We never ask these questions on issues of war. We never ask these questions on issues of tax cuts. Tax cuts add to the deficit. They're not paid for just magically in the way that Republicans like to act. They are hard things that you need to pay for. Wars. You have to pay for those. Those things are trillions of dollars that we, without any debate per se, just increase. The last military budget increase, if I am not mistaken, was more than what Russia pays for its entire military. To give you some notion of how grotesque this is, I mean, we pay, 8 times more than the next populations, many of which are our friends combined? We don't ask those questions on those issues. Hey, let's ensure people get health care. Let's ensure people can go to school without having mountains of debt. Let's ensure that the elderly don't go into retirement persistently vulnerable for the entirety of their life, giving their muscles and their brains to ensure that our society functions in the way that it does, meaning it persists itself. We don't ask those questions. AOC is right. One catch. You still have to answer that. Being right is different than the politics. Meaning, yes, you're right. You're also right. But that doesn't mean that they're not going to attack you relentlessly on it and not being entirely honest in the way that they're attacking you on it. Let's talk about this shortly, for short term. Welcome to the Soapbox. My name is Jamarl Thomas. This is the Progressive Soapbox. Guys, if you dig this content, like, share, subscribe. You can always support PayPal, Patreon. This content is brought to you by you. AOC, absolutely right. We don't ask these questions on issues of war, nor do we ask these questions on issues of tax cuts. When it gets to healthcare, education, the elderly, all of a sudden, we're broke. And all of these questions come up on how you're going to pay for it. It is true what she's saying. Absolutely right. It is true that this is a massive income increase for the population itself. It is true that the healthcare thing can be considered a tax because for all intents and purposes, it is. And it's a tax that you can't get away from. What do you get your cancer meds? My wife earlier today was angry, viciously so, because her insurance company just told her she can't go to the pharmacy that is near us, that we typically use. Why? Because they want to increase their profits, and you go into that particular pharmacy, they can't get a good deal off of it. And this notion that, we don't want to throw people off the healthcare rolls, and we don't want to change their insurance. We want people to have a choice. Even that's nonsense. She didn't get a choice in the healthcare insurance that she got. Her job said, this is the insurance that we're using. Take it or leave it. I'm saying that's across the country. I am completely unaware of any company that I worked at where I had the choice on my healthcare. They may say, here are our options, but nevertheless, I didn't get a choice in those options. What is in the best interest of the job itself, meaning how can they save cash, and what is in the best interest of the healthcare insurance company for them to maximize their profit? At no point in either of these situations in which the people are looking at it did I get a choice. The choice argument is nonsense. The politics, however, says something different, and that doesn't matter. You still have to answer that. And you still have to answer that, I would argue, from the sense of policy. Now, Sanders is given multiple options on how to pay for Medicare for all, and he says we are going to pay for everything that we do. I believe him. I strongly suspect that he's going to increase taxes on the 1%, not to mention probably some other stuff around the bend, but I believe him when he says we're going to pay for our program. The impact to the deficit, meaning an increase in the amount of the deficit, is not a disincentive to do it. Tax cuts, military, these things aren't factored in when, but in the context of the deficit. Yes, Sanders will have to answer this question. Yes, Sanders will have to explain how we're going to pay for these particular programs. That doesn't mean that everything that AOC said wasn't true. Everything she said was true. But you're dealing with a country that has been propagandized or has propaganda just slathered on it for the last 20, 30, 40 years saying you can't have nice things. We can't do big things. The best that you can do is radical incrementalism, where you can do this piecemeal solutions that still leave 20 million people off the healthcare rolls. It takes a bit to get out of that. The media, millionaires 10 times over. The billionaire class that pays them. The politicians that don't want to enact these policies because they too are paid by those millionaires and those billionaires. All of these groups are against it because all of these groups have political reasons to be against it. That doesn't mean that you can't and don't have to explain how it's paid for. I hope you understand my point. Both things are true. You're dealing with a public that has been told forever that it is impossible to do so. So the public needs you, even if you create a document just to make your point. You know that that document is going to change because it's going to be negotiated. It doesn't stop you, however, from coming up with a policy position that would at the very least allow them from stop filling in the blanks. If they fill in the blanks, they're going to do so with a dark eye, as opposed to you who wrote the bill, who may be able to make this argument within the context of a policy document that is acceptable. You still have to answer it. Otherwise, stuff like this is going to happen.
Do you think it's important to identify revenue sources for the other half, or do you believe, as those who say subscribe to modern monetary theory believe, that we've been a little bit too constrained by concerns about the deficit, and that's not so important to pay for everything?
The fight that I have been waging says that A, healthcare is a human right. Mm-hmm. We've got to join the rest of the world guaranteeing healthcare to all people. And B, I want to do away with all premiums, all co-payments, all deductibles, and out-of-pocket expenses. And I believe that through a progressive tax approach, the overwhelming majority of people, you got working class people now paying 15 or 20% of their incomes for healthcare. I'm going to lower the cost of healthcare. And then what I understand is the situation. And let my Wall Street friends there tell me why it makes sense.
You have Wall Street friends?
No, I know. That was just a metaphor. I was trying to sound nice. I know. But, you know, please, you defend for me. Amazon, owned by the wealthiest guy in the country, making $11 billion in profits last year, not paying a nickel in federal income taxes. I want to hear the defense. John, I don't hear it. There is no defense. And it's not just Amazon. It's dozens of these corporations.
So you do plan to propose the other $16 billion in
federal taxes are already paying, roughly speaking, 60% of healthcare costs through Medicare, Medicaid, CHIP, and other healthcare programs.
Mm-hmm. So you still have more revenue to go to make it fully paid for.
What we have laid out is, look, the fight right now is to get the American people to understand that we're spending twice as much per capita, that of course we can pay for it. We're paying it now in a very reactionary, regressive way. I want to pay for it in a progressive way. That's my fight now. Now you're asking me to come up with an exact detailed plan of how, you know, every American, how much you're going to pay more in taxes, how much I'm going to pay. I don't think I have to do that right now. What I have to say, and be honest, is to say, yeah.
You think it's foolish that Senator Warren's trying to?
I'm not saying it's foolish. I'm not saying it's foolish.
Because some people are saying that. Like, why?
Their class hates. He hounded Sanders. Sanders over and over again gave him an answer. Look, yes, moderately so, taxes for the middle class will go up. But from the standpoint of earnings, savings, the amount that they bring home in their paychecks, they will see a dramatic decline. In fact, 2 economists came out and said it was the largest increase in bring home that has taken place in a generation. Sanders answers that question. He goes over that for like 4 or 5 minutes where he's trying to explain to him, look, I've laid out all sorts of ways of us paying for it. He even brings up Amazon. Jeff Bezos pays no taxes. His point is, yes, we will raise taxes on the top 1% in order to pay for this plan. Not to mention we'll find revenue elsewhere. We will do it. The problem is Sanders says we're trying to pay for the damn thing. Don't say that. Don't say that. And eventually he gets to the point of saying, look, I don't really need to be explicit into how each individual person will have their taxes go up or down. The issue here is savings. We pay twice as much as everywhere else in the world. Clearly we can pay for it because we're paying for it now in a reactionary way. That doesn't stop this headline from coming up. Sanders says he doesn't need to come up with an exact detailed plan right now. Now, I did this video the other day where you could hear Sanders talk about this in long, drawn-out terms and trying to explain to him. That doesn't stop CNN from coming up with that very specific Headline. What AOC is saying here is right. She's absolutely right. Her being right doesn't stop groups like CNN, Washington Post, for still bringing up this particular question on how do you pay for it? How do you pay for it? And from a political standpoint, you need to have an answer, a document to be able to explain it in detail. And Sanders, yes, he's given his healthcare plan. And yes, he's given how the motley crew of expenses or revenue that can be raised based on various things that he can do while he's in office. But you need to be able to also articulate that. Yes, the vision is extremely important. And to be able to argue this notion of vision, to argue that we pay twice as much as everywhere else in the world, argue that the income for the American taxpayer will go up, his savings will go up, his point of sale taxes will go away, even though his taxes will go up moderately. And that's assuming you make over $20,000 a year. If you make less, you don't pay. This beautifully spirited defense is on point and is accurate. That's not going to stop them from hounding you. That is not going to stop them when they get on the debate stage. If Warren does indeed come up with a policy proposal on how do you pay for it, they're going to look to you and say, well, she's explaining how she's going to pay for it. Why aren't you? They're going to try to find division. AOC has, what's her name? Klobuchar has already said, well, Warren is hiding the ball. She's being disingenuous and being dishonest, and tying you into her dishonesty because she's been arguing that whatever she's talking about is Medicare for all, meaning Warren. No issue with her answer, just with the extra thing of a policy position and how you pay for it in detail is important. Even if you know that that policy position will get ditched when you're arguing and haggling because other people are going to have different ideas on what that policy position is, and you need to be able to get it through Congress. But at the very least, you should have a policy position in paper detailing how it's done. You can't hide the ball. You only get one chance to make this right. And if it is beneficial to the public, you should be able to explain. So, again, spirited defense. Nothing's wrong with it. Everything that she said was right. Same thing with Sanders. An amazing interview with CNBC where Sanders knocks it out of the park. And despite him knocking out of the park, despite him explaining to that guy in long form detail on how he plans on paying for it and so forth, and giving full-blown explanation for like 5 minutes, CNN still goes with this headline. Sanders doesn't need to come up with an exact detailed plan right now on how to pay for Medicare for all. That headline is disastrous. If you watch the interview for yourself, Sanders gets exasperated with the guy because he keeps telling the guy how he intends to pay for it. And finally, in a quip, we don't need to do that right now. And despite all of the explanation that went into it, this is the headline that CNN comes up with. My point is, you don't want them filling in the gaps. You don't want them filling in the gaps. I don't entirely remember when this interview took place. I don't know if it happened immediately, but I know she's been on CNN before making this argument. Good argument. Good defense. Good putting it into people's minds of, wait a minute, we pay for these other things. We also pay twice as much. Clearly, we should be able to do it. Perfect. No issue. Policy. And Sanders, with a policy position explicitly in making up the other gap in regards to revenue, is somewhat necessary. Not for me. Vision matters more to me. The fact that the person means it matters more to me. The policy and those type of things can be worked out since you believe that the person who's pushing it is a true believer. But that is not entirely true for the rest of the American population. And this gets back to my point. A population that has been propagandized to that says you can't have nice things. And now you have a candidate saying you can have nice things, gets hit with a certain degree of skepticism over it. You need to dispel the skepticism. Vision, yes. Sincerity, yes. Policy, also. Medicare for all is a bill. You're either for it or you're against it. But I am not against Sanders coming up with a policy position in detail, explicitly, for the gaps, because I don't want this nonsense to happen over and over and over again, where they continuously hound and dog them for that particular issue. Get ahead of it, because that is exactly what is coming up and what you will be asked on that debate stage. This headline will be the way that you are engaged. And that needs to be neutered before the next debate. And I would even argue before Warren comes out with her healthcare plan. Like, share, subscribe. Thanks all. I see you. I don't want to miss this super chat. Vox Veritas. An argument I don't hear being made for Medicare for all is, quote unquote, the portion for medical liability you can pay on car insurance should also go away. Let me repeat it. Vox Veritas. An argument I don't hear being made for Medicare for all is the portion for medical liability you pay on car insurance will and should go away. I don't want to miss super chats, and YouTube wasn't showing me the fact that I had one. So I wanted to come back and give that because I don't want it to be missed. Like, share, subscribe. Thanks all.